like NEET has been a joke. So what's the current situation and what's your take on it?
NEET is not a joke. गलती सबसे होती है. To err is to human, right?
What is the return of investment on a dental career?
देखो, पहले तो आप दूसरा डेंटिस्ट के पास जा रहे हो तो आप सीखने जा रहे हो.
आपको पहली बात तो खुद का सेटअप होना चाहिए, क्योंकि उसके बिना आप ये करियर में नहीं जा सकते हो. एंड इज दैट द सेम विद MBBS आल्सो?
नहीं.
So coming to next question, a lot of students are confused that हमें ये बोला जाता है कि मतलब मुझे भी बोला गया था कि BDS के बाद आपको MDS नहीं करना है, पर आज के टाइम पे वो ट्रेंड नहीं है. Everybody wants to do an MDS, which is why so many people are even applying for it. तो आपको अभी भी लगता है कि सिर्फ एक BDS करने से आप क्लिनिक खोल सकते हो, अच्छे पैसे कमा सकते हो?
आपने MDS भी कर लिया और आप अगर काम ही नहीं सीखे तो फिर आपने क्या किया?
बट ठीक है,
काम सीखा तो अच्छी बात है. आज के दिन भी देयर आर मेनी डेंटिस्ट who has just completed their BDS or who are doing means we are practicing as a BDS and they are doing relatively better than the MDS graduates.
Okay.
Yes, the world is changing. We have to accept that. We are looking for more specialized person for the treatment. If I wants to get my root canal done, or if I want to get my ortho treatment done, I will definitely try to visit a old practicing orthodontist and an endodontist instead of going to a BDS graduate.
Yes.
So yes, it is good if you do.
But it's not a must.
It is not a must, but it's yes, because see, in small towns or 2-tier cities, definitely you don't require it. But just imagine if you are staying in Bombay, Delhi, such kind of metros, then need to get the specialization done. It looks good also. थोड़ा
So I
good feeling भी है.
thought कि अगर मुझे डेंटिस्ट्री आगे प्रैक्टिस करनी है तो I should go to a tier 2 city. Because वहाँ पे there is scope that I can try, I can learn, I can grow, but that stops in a metro city because there's always competition. You're always surrounded by people who are definitely better.
Correct.
And then there is no scope for you to grow as a professional.
Because in today's era, people know the difference of BDS and MDS.
Correct.
They might not be knowing what is the difference between the MDS in orthodontist and MDS in oral medicine.
Yeah.
But they definitely can see BDS, MDS.
Yeah. Just that tag is enough for them
Yes.
to decide whether they want to get a treatment from you.
Correct.
Right.
And maybe this mentality will also change after the awareness. Means awareness, as soon as the people come to know what is the difference between orthodontist and endodontist, definitely.
Which is coming.
Which is coming, yes.
Media.
Yes.
But I understood one thing after BDS, that only your core skills, what the college teaches you, is not enough. In the sense that you need to know so many other things apart from what you learn in a college. So how can a student who is doing their BDS in the course itself upskill so that they are able to put a clinic after 5 years? I felt that 20 years ago, somebody had the confidence when they came out of a BDS college कि आज मैं कल उठ के clinic लगा सकता हूँ. Today when I came out, I was like, यार मैं scaling भी कर पाऊँगी. So how do you get through that?
See, 20 years ago, the number of colleges were less. The number of patients on those colleges were more. The kind of hands-on that the students used to get is exceptional.
Yeah.
This time has changed. Now the number of colleges have increased. The patients got divided.
Yeah.
So yes, you can learn that by getting a salary of 2,000 to 4,000 by practicing under somebody. There you can observe and learn. This is the best way.
Right. So you are supposed to take that as an internship and an opportunity to learn rather than a salary.
Of course, yes. हाँ, आप सीखने जा रहे हो, आपको सीखना है. Salary should not matter unless and until you are too confident कि नहीं, I can do all the job. and this is not worth me. Means I am worth something more. You will realize your worth. That is for a fact.
You will realize your worth and you will demand it if you are confident enough to do that.
If you can work, if you can do the kind of work which the other person is expecting, definitely after 1 month you can put a pressure on him. ठीक है कि मैं छोड़ के चली जाऊंगी या तो मेरे को इतना तो the other person will have no other option. This is same as in working in a MNC or anywhere.
Right. But this is more of a career where you work for yourself. You work during your hours. I've seen dentists just have 4 hours or 2 hours. मतलब cleaning घर के नीचे है and they have their set of patients who are coming in, going out. They have a very flexible life.
Flexible life, work-life balance, good money, सब कुछ तो है इस प्रोफेशन में.
That's about looking at the long-term perspective of BDS. You can compare it. You can meet a lot of people. I personally say कि बहुत सारी चीजें LinkedIn पे ही हो जाती है क्योंकि आपको नेगेटिव साइड्स भी दिख रहे हैं और वही चीज के पॉजिटिव साइड्स भी दिख रहे हैं. तो अगर आप बस LinkedIn पे जाओ, पढ़ लो, Instagram पे जाओ, नॉलेज ले लो, इतने वेबसाइट्स है टू अंडरस्टैंड करियर मुद्रा, where the student can just open the internet and there is a pool of information that's available, positive and negative. Now you decide आपको positive लेना है या negative.
Correct.
क्योंकि हर फील्ड में उसके perks हैं और उसके downfalls हैं. So coming to the last part of this podcast, मैंने literally because मैंने अपने surroundings में देखा है कि 9 subjects है. अब हमें तो बोला जाता है कि internship में आप 9 subjects की पोस्टिंग कर रहे हो ताकि आपको पता चले कि आप क्या चीज में अच्छे हो. बट एट द एंड ऑफ द डे लोग वही ले रहे हैं जो जहाँ पे स्कोप है, विच दे आर सेइंग कि क्लिनिकल ब्रांचेस में है. अब मुझे नहीं पता. एंड नॉन क्लिनिकल जो 3 सब्जेक्ट्स है वो उन्हें सेग्रीगेट कर दिया कि मतलब बचे ही 6 सब्जेक्ट फॉर देम टू चूज बिटवीन. उसमें से 2-3 सब्जेक्ट होते हैं जो आपको पर्सनली पसंद नहीं होते हैं बिकॉज आपने इतने पेशेंट्स किए होते हैं. And then eventually they end up taking that one subject they may or may not like, but that's a decision based on somebody else's opinion about that subject. So what's your take on MDS, which subject to choose and how to go about it?
Which subject to choose is a very interesting topic because it depends upon your passion. If I want to do ortho, that means I want to do ortho.
Yeah.
If my interest is in oral surgery, then I will do oral surgery. But yes, there are 3 unglorified branches like oral medicine, oral pathology, and community dentistry, which actually has got more return on investment. I will always consider return on investment other than saying something else because this is the correct term in my eyes. For something which you are investing, you should be able to get the return.
Yes.
I think that there is more potential in these 3 branches as compared to many other branches as well. See, you have to create a own niche for it. I've seen many doctors who have done their post-graduation in oral medicine. On one side, they are running their own clinic. They are practicing as a general dentist. On the other side, they have opened up their own CBCT centers.
You have multiple.
On the third sector, they visit the clinics in order to diagnose a problem because there are many symptoms which a normal dentist or a dentist from the other branches cannot identify, and the oral medicine and radiologist is the perfect person to diagnose the disease.
Okay.
Right? They charge for that as a visiting dentist. Then they create a treatment plan also and they share it with the other fellow dentist for which they charge. So just imagine the number of businesses which they have created. So you have to always look at the broader sector. Apart from thinking नहीं oral medicine है मैं क्या करूँ मतलब इतना सारा चीज है करने के लिए, कुछ तो करो.
So you have to open up your mind to understand the business perspective also. मतलब सिर्फ ये सोच के कि वो काम क्या है या वो सब्जेक्ट क्या है, you have to open up your mind and think कि ये बिजनेस में मैं क्या क्या ऐड कर सकता हूँ जिससे मैं कमा सकता हूँ.
The same goes for the pathology as well. In the medical profession, now there are very less takers for MD in pathology because they think that there are machineries which has come which gets the job done. ठीक है, that is true. आप सोचो कि आप 4 बड़े बड़े अपार्टमेंट्स के बीच में आपने एक छोटा सा सेंटर खोला है. आपने 1 या 2 आदमी रखे जो ब्लड सैंपल, यूरिन सैंपल कलेक्ट कर रहे हैं, और nowadays everybody wants to get their regular health checkups done in 1 month, 2 month, 3 month, 4 month. 4 सोसाइटी बीच में आपके पास रोज इतने सारे सैंपल्स आ रहे हैं. What more do you want?
Yeah.
Now you don't want to get satisfied in that also. I am not treating patient. That is a different sector.
So that you have to know whether you want to treat a patient or not.
Yeah.
And then based on that decide. But at the same time, think about it that you need to get back that money
and satisfaction is 2 different things. देखो, सरस्वती के पीछे ही लक्ष्मी आती है. तो सरस्वती तो होना जरूरी है. तो ऐसा नहीं है कि कोई भी ब्रांच बुरा है या उसकी वैल्यू नहीं है. नहीं, ऐसा नहीं है. मैं जो कर सकता हूँ वो सामने वाला दूसरा ब्रांच वाला नहीं कर सकता है. वो जो कर सकता है वो ये नहीं कर सकता है. ऐसा है.
तो अगर मैं आपके पास कंफ्यूज स्टेट में आई होती लास्ट ईयर, तो आप मुझे मतलब क्या क्या चीजें रेकमेंड करते हैं? मतलब
मैं आपको रेकमेंड करने से पहले मैं आपको पूछता, because I have to see your background also, from where you have done your dentistry, what is your parents' background, what is your interest, what is your expectations, क्या करना पसंद करते हो, आपने अपनी लाइफ में क्या सोच के डेंटिस्ट्री चूज किया, आप क्या चाहते हो, सुबह से रात तक आप क्लिनिक में रहो, या आप चाहते हो कि नहीं आप एक चेयर में बैठ के आप एज ए एंटरप्रेन्योर आप कुछ करो ताकि ठीक है लाइफ भी स्मूथ रहे. I would have asked you such kind of questions, the all set of questions. Then I would have put my inputs on it. है ना? तो ऐसा नहीं है कि if I am telling that no, do endo, it is better. No. ऐसा नहीं है.
It's a very personalized.
It is a very personalized.
It's very personal to each individual who comes.
Correct.
But they need it because the world says something else. Like in a college setup, they'll be like clinical. Just like before me, they were like MBBS, MDS. So you need people around you who can break that barrier, right?
You need a correct mentor.
Yeah, mentor.
And the mentor from the same profession, nothing can be better than it.
Who has seen the world from another perspective.
Yes.
They can at least tell you about it.
Yeah. Because they have seen everything. Yeah. Almost everything. Not everything if you say. यहाँ बहुत कुछ देखे हैं. लोगों को अपना प्रोफेशन डिग्रेड करते हुए भी देखा है, एट द सेम टाइम पर्सनल लेवल पे ग्रो करते हुए भी देखा है. तो बहुत सारी चीज़ें हैं. That is why at the start of our conversation I told you, means I suggested, discuss, talk, discuss, then take a decision based on your personal interest. But understand the perspective of everybody.
Right. So there is this saying that your network is your net worth. It does not just apply to once you start making money. It applies from the beginning because your decisions are going to be made on your network and the people you meet and their experiences.
Correct.
So it starts, this entire saying does not just start for money, but it starts right before you even enter the field. And the more number of people you talk to, the more number of perspectives you get. I mean, you don't have to be bound to your 5 people in college, because then you are very restricted to only the mindsets of 5 people.
Yes.
But as you grow and you have 5, say 50, you have just changed the way you think.
You have to expand your horizons.
Right. So it applies to anyone who is even starting out. I think we didn't know about such things, but having you here, we've understood that there is a way to do it. There is a certain path to take up. And if you clarify things within yourself, there is no other way there is no other person who can choose for you.
Correct. Choose a mentor, take the decision by yourself.
And how do you choose a mentor? I mean, it's really hard.
Yeah. So after talking to 5 persons, you will find one person whom you can trust and with whom you are comfortable.
Correct.
That is how you do it. Because even if you go to a doctor, you try to take a second opinion as well. कि चलो हम लोग दूसरा opinion भी दे लेते हैं. Why? Just because of the mental satisfaction.
So yes, that was it for today, and I hope it was beneficial to have this talk. And a lot of students open their minds. I think that's all they need at this point. Which course you do, which college you do it from is very secondary, but who you are will eventually make your career, your personal life, everything.
One more thing is it is not really important to get confined into the same profession which you have studied, right? You can explore other options as well.
100%. In today's generation to 100%.
Correct. It is not कि आपने MBBS किया है तो आपको वही करना है. मैंने देखा है. Let's talk about our dentistry only. I just forgot that lady's name. Her name is some Chauhan. She specialized in body casting.
Okay.
She is a prosthodontist. A very famous doctor. She is practicing in Dubai.
Okay.
Yeah. I forgot her name. Then one more dentist from our field, she conquered Mount Everest or some this one, what is called, कोई तो भी एक Mount Everest only, I think, up to some limit. So there are many other things which you can explore.
Live examples. I mean, you don't have to do things. You don't have to do things that your career or your degree asks you to do.
Correct.
And you don't have to put so much of pressure, I think, at the age of 17 and 18 कि shit मुझे 20 साल के बाद का सोचना है. Because
बच्चों को खुला छोड़ना चाहिए कि करो. देखो, you can make mistake up to a point of time. You can make mistake and stand up very easily. Correct. You cannot think of making mistake after or taking risk after you are 50, 55. ठीक है, there are examples everywhere where people have taken risk after 50, 55, 60 and they have grown exponentially. But we cannot analyze, do this based on a very small data. Let's look at the broader spectrum. आप गलती करते रहो, सीखते रहो. It can happen up to the age of time. You can keep taking risk, right? तो बच्चों को खुला छोड़ना चाहिए. Let them do what they want. नहीं तो parents will not know their children's strength. उन लोग को भी पता होना है कि हमारा बच्चा का, अरे it will come as a surprise. हाँ, मेरा बच्चा का ये कैपेबिलिटी था. करेक्ट, मेरा बच्चा का ये कैपेबिलिटी था कि will not know. तो instead of feeding कि ठीक है यही करना है, let them keep on doing, keep them observing, keep them guiding, give them confidence कि ठीक है करो, देखेंगे, ट्राई करो,
रिस्क ले लो, देखा जाएगा क्या होगा, क्या ही होगा, you know, like what's the max
क्या ही होगा.
that can go wrong. If you think like that, I think the entire
Dr. Ashwini, she is a dental photographer and a wildlife photographer as well.
Okay.
She is an endodontist.
Okay.
So there are many examples like this.
Right. So knowing about that is also important, right? Because you think, oh no, this is the only thing I can do. But then there are so many examples of people who tell you, no, you can do this. And
Because all these peoples are not that famous that they have come, the people know them.
correct.
You have to search for them, then you will come to know. Of course, there are people everywhere from other fields and other sectors as well.
Right.
The Education Minister of Karnataka, he is a prosthodontist,
Oh, really?
Dr. Sudhakar sir.
Okay, I didn't know about that.
Then, so you can get many examples.
Alright, so this was really nice, and I hope we have a part 2 once we see students understand this perspective and then they ask us questions, more questions, I would say.
Thank you,
Thank you
Doctor.
so much for your time. It was really nice talking to you.
Same.
Wait, there's more. But before we go further down the rabbit hole, subscribe to our channel.